Hello, everyone. It's Wednesday, September the 9th. Regretfully, I've got to again start with, telling you that we've lost 4 more West Virginians. Our 251st death in the state was a 59-year-old female from Harrison County. Our 252nd death was a 69-year-old female from Harrison County. Our 253rd death was a 62-year-old female from Jackson County. And our 254th death was an 87-year-old female from Monroe County. Before I go any further, I would just tell you this. All West Virginians should surely be aware that now we've lost 254 people in the state of West Virginia. As we all know, compared to the other states that are around us or states across this country and everything, that number really looks pretty good if you look at that. But to these people, to these families, those numbers don't mean anything. And absolutely, please keep these great people in your thoughts and prayers everywhere, because they need that and they deserve that. Now, let me just jump right into the numbers, and you know that I have always told you the truth, and I have always called on your support, and you know how much that I call on God above to try to help us. West Virginia, we are absolutely getting worse by the day, and this situation right now is very critical. You need to all know that. And you need to all know that everyone is trying their hardest to do the very best that they possibly can for you. But West Virginians, you're going to have to buckle down. Absolutely, today our positivity rate for the day is at 7.78%. That's really bad. Now, our cumulative positive is rising and is at 2.55. Do you remember not long ago it was at 1.6? Now, that's a lot, when you get down to the low percentages, to move a low percentage, and the best example I could possibly give you is if you were to dry sand, and let's say you got sand down to a 3% moisture and you wanted to take it lower. Well, it's difficult to do when it gets to 3%, but if it was at 30%, it was wringing wet, you could move it from 30 to 20 easy. You can't move from 3, it's bone dry, on down very easily. We had our positivity rate at 1.6%. It was very difficult to move it lower, but absolutely today it's at 2.55 and our daily rate is at 7.78. We have now added another county in the orange. You're reviewing to make absolutely certain that Pocahontas County is absolutely legitimately orange. But for what we know at this moment, it is. That's our 10th county that is either red or orange. Absolutely, this situation, we have active cases of 2,806. That's another record high. We have the worst reproduction rate. The RT rate is at 1.35. It's the worst in the nation. The only thing is our hospitalized people and the number of patients has dropped just a little bit from 152 down to 147. We have 8,740 people or 48 cases that have recovered now, and that's good. But absolutely, I call on all West Virginians at this moment, not only for your prayers, but to just know that we are reaching a very, very critical time, a time when we have got to do better. We have got to do any and everything we can to do better. Now, a great many of our counties, 45 out of our 55 counties are still green and yellow. And as far as how it went on our first day of coming back to school, I think, Superintendent Birch is going to tell you that everything went pretty steadgum smooth. But we've got counties here in which we don't have our kids back in school. And I want them back in school so bad, just as badly as everyone does. I absolutely want our kids, first and foremost, back in school. But with this situation like this right now, there's no possibility. There's no possibility that we should be back in school in these counties that are orange or green or red at this point in time, because this situation is becoming more and more critical, and that would only compound the bad in the situation that we already have. So as we move forward, West Virginia, we're going to continue to stay the course. We're going to continue to stay the course from the standpoint of being as safe as we possibly can be, and yet get our kids back in school and hopefully back on the playing fields. But first and foremost, we have got to look out after our kids, our teachers, our service personnel. We cannot just compound the situation and make it worse. We have no school outbreaks, no new school outbreaks reported, from DHHR since yesterday. The long-term care facilities, now we have 32 outbreaks in long-term care facilities. I think that's slightly down from yesterday. Our churches, we were at 5, yesterday, or day before yesterday, we're at 4 now with Kanawha, Wayne, Monroe, and Wyoming counties. Please remember all the distancing things that we've said so many times, as far as a pew in between, as far as, the proper social distancing. Please wear a mask. From the standpoint of corrections, I told you last week that corrections ran to the fire when several employees were tested positive at the Beckley Correctional Center. They tested all inmates and all staff. All 40 inmates tested negative. There were 7 positive employee cases. We now have active cases among 105 inmates and 21 staff at Mount Olive. We have 1 positive inmate at South Central Regional Jail and 1 positive inmate at Western Regional. We have a total of 31 active cases among our correctional staff. Before I go any further on that, just hear me out on this. If we could have some way excluded all the staff, all the correctional officers and or staff that are working, where would we be today? We would be a lot better off than we are today. Now, this responsibility doesn't lie exclusively with them. This responsibility, lies, all across the spectrum. But it's just flat factual that as we travel, as we go about our daily lives and we go about normalcy, and we traveled and we did this and we went to Myrtle Beach and we came home and we felt fine and we didn't have a temperature and we went into a nursing home either to visit and or staff or whatever it may be, and we absolutely had this disease and didn't even know it, and then it just took off all over the place. And in that, then we lost a lot of people. We did the same thing at hospitals. We did the same thing in a lot of different places. The bottom line is just this. I know you've got to live your daily lives, but when we tell you that it is absolutely not advisable to go to Myrtle Beach, hang out there and everything on the beach where people are just moving all about and everything, and you do that, then it can cause real repercussions. We're not going to tell you anything unless it is vetted by the medical, the educational, the athletic, every potential expert that we can have weigh in. We're not going to tell you something that is not trying to at least be beneficial to you in your lives. We've pleaded with you over and over to wear your mask. You're doing a great job there, but you can even do better. We tell you over and over how travel can cause us a real problem. I was just advised by my general counsel that I think New Jersey and New York are basically banning West Virginians from coming there or asking them to quarantine or whatever it may be. You know, and I'm sorry, that was New York and Connecticut. I mean, are you kidding me? I mean, really and truly, New York and Connecticut, the absolute places where this was the worst of the worst, and they're looking at West Virginia as maybe West Virginia is as a place that they need to be concerned about. It's not good. And so we've got to turn the tide, West Virginians, and you can do it. And you can do it with great cooperation and everybody pulling this rope together. As far as workforce today, I am very happy to announce that early next week, our $400, which is $300, from the feds and $100 from the state, are going to start flowing to all those that are in bad need. And it's taken a while, and the reason it's taken a while is once we got the go-ahead from FEMA, we had to devise our own system to be able to administer the monies and get the monies going out. Now keep in mind this too, we were one of only 4 states that stepped up to the plate and said we're going to do the extra $100. So we'll get everybody their monies. And I think, that the effort to try to prevent fraud and everything and create that system that was able to keep us from, people invading and just, the fraud situation is surely rampant in a lot of different places. We don't want it here. We've caught instances, and I know as well as I'm sitting here, that we have people that have absolutely done the wrong thing and everything, and we missed it. And they temporarily won. But nevertheless, Scott Adkins will be with us today, and if you've got any questions from the media towards Scott Adkins, he can maybe answer those better. Yesterday, I got a question from Mark Curtis, that involved evictions, and what I can tell you my personal feelings. I can plead with the landlords and everything that please don't evict people now. Please don't do that. But I do not have the power to make law. And really and truly, this pandemic is terrible, and I can plead with the landlords to do that, but I can't make them do that. Now, in other states, there may be governors out there in other states that have that authority and have that power. I do not. And our Supreme Court could possibly, act on this and halt those actions if they chose to do so. And President Trump also gave some relief, under his executive order, which directed the CDC to temporary halt evictions through the end of the year. But all that, it just takes cooperation and law from all the way from the top down. Today, I want to recognize the National Guard. They've been on the job for 180 straight days, and they've done great stuff. They continue to run to the fire all over the place. At the height of this response, there were 700 Guard members that were working and had called back to active duty and everything to help us. There was missions and multitudes of missions in all 55 counties. Currently, there are 330 personnel that are remaining on duty. And today I ask all West Virginians, just take a moment in prayer to thank them, for all that they've done. And surely if you see one of them and they happen to be in a restaurant, you can afford it, go pick up their dinner, pat them on the back and tell them, what a great job they're doing. From our small business grants, we're continuing to process. We've got 3,500 applications now. We got out a little over $13 million. And we're continuing to send the money out the door just as soon as we can get the applications in and get you qualified. So you're running out of time now to get your application in. It all ends on September the 30th, so we need you to get at it and get applying if we're going to be able to send you these dollars. From the standpoint of our cities and our counties, we've sent out $105 million plus to 191 cities and counties across the state. We ask them to continue to apply. Keep applying, and we'll keep getting you through the process and send the money out. From the standpoint of our testing today we're in Mason, Mingo, and Morgan counties. Also this week we'll be in Putnam, Cabell, and Mercer counties. This weekend we'll be in Raleigh, Wayne, and Mon counties. I want to just say just this. You know, in the state of West Virginia, where we've had somewhat limited testing capabilities, although we've tested 463,686 tests that have been done so far, which is an enormous amount of tests. You know, approaching 25% of the whole population of the whole state. But while we're testing, we are just testing, for the most part, in many situations, people that have an issue, or maybe it is suspected that they have a problem with this. That's why it would have been so beneficial to all of us if we would have been able to do the testing to the kids and everything from the standpoint of the athletics when we had that 1 week. Because to be perfectly honest, I've said it a bunch of times, and I don't want to go back and rehash that situation, but if we would have done so, we would have, without question, we would have flooded, you know, the Kanawha County situation with a lot of negative tests that would have influenced the color system substantially. But from a medical standpoint, it would have given us more insight. It would have helped us if we found someone positive that was out with kids, or a kid that was positive. We could have isolated them for a while. If we'd have had a positive test, we would have absolutely retested, you know, but we missed an opportunity there. But what I'm trying to say to you is just this. We need, the more we test, the more we know, but we need an abundance of testing also that are people that are asymptomatic, or people that don't necessarily have symptoms, and across a giant demographic from the standpoint of ages, because that will help us with more and more information. Plus, it will absolutely not skew the numbers from the standpoint of looking at this, because all we test are the sick. And that's not what we do, but I'm exaggerating to make my point. We want the bigger demographic. So the more testing that we can do, the better off we'll be in so many instances, because it will give us knowledge. If in fact, here's a great example. If in fact we tested a bunch of kids and we found out that there is the presence of positivity in a bunch of kids, then we react and we know stuff. You know, right now, you know, what we don't have is a good feel for the great demographic testing. So I encourage all, you know, as we're testing all over the place and everything, if you feel like you can do that and everything, go get tested. Go get tested. The more we test, the more we learn. The more we learn, the faster we'll get rid of this crazy, terrible killer epidemic or pandemic. And so go get tested. From the standpoint of the census, we're at 97.3%. It always brings a smile on my face. It's really good, West Virginia. You've done so good in so many ways, and I'll always be beholding and really proud of the effort that you've made, because you've done just so good. You've listened so closely. You've stayed all together. And now, you know, we don't want to divide ourselves because we've got, you know, an Orange County here and a green or yellow county over here. We got an issue and a challenge. But I am telling all West Virginians right now, as I issue that challenge, we are at a critical point, and the odds are it could even get worse, because as we move forward and continue to try to do things like be back in school and everything else, the odds are we get more exposed. And so we have got to be super careful. We've got to do all in our power to continue to try to drive this killer away from us and everything. And as we do so, really and true, we're just absolutely looking at every day we're closer and closer and closer to that vaccine. So that's all I got today. You know, I do want to do one other thing. I want to go over this chart just real quick. If you look up at the top, the number of active cases and recovered cases, where we were widening, it's squeezed in a little bit. If you look down at the bottom, the chart at the bottom shows our positivity rate above that dotted line and everything, and it's slowly creeping up. And either the bottom or the top are not terribly alarming. But look at the middle chart. And look at these days that we have right toward the end of the chart. Look at what's happening right there. That's our daily positivity. And it's going crazy right there at the end where we're at right now. And we got to do something about that. And we've got to turn it around. We have got to turn this around and turn it around right now. Now, from the standpoint of our orange counties, that's a real problem. From the standpoint of our red counties, it is a colossal problem. From the standpoint of the worry about our green, it is an absolute problem there too, and as well as our yellow. Now, let me tell you one other thing, and I missed this right off the get-go. It's the very first thing that I was going to tell you. You know, from the standpoint of the mapping that comes out on Saturday night that tells us about being in school, about playing sports, about practicing only, and all that kind of stuff, we're bringing it out at 9 o'clock. And I told you on Monday we were going to back that up, because I think we can back that up, and that'll give you a few more hours that maybe you can line up daycare or whatever it may be that you need for the next week if your county would happen to slip into, to orange or whatever it may be. So with all that being said, from the standpoint of athletics or whatever, we're going to move that time. We're going to, let's say we're going to come out at 5 o'clock. I was going to say 4:45, but from the news, cast and everything, that they could pick it up easier. But our panel will conclude all their work and everything, and we'll come out with it at 5 o'clock right on the money on Saturday night from this point forward. Anyway, thank you so much.
All right, thank you, Governor. Let's now go to Clayton Birch, West Virginia's Superintendent of Schools.
Good day. Thank you, Governor. And I'll kind of start where you left off with the 5 o'clock release. As of today, we had about 200,000 hits on the website going to that map. Some folks asked if the map crashed on Saturday night. It did not. It was just slow due to 3,700 people per minute trying to log on to look at that. So we know how important that is to everybody, and I think that we heard also yesterday many parents indicated that earlier would be better. So, Governor, we do appreciate that, and I appreciate all the work that the expert panel will do to make that happen by 5 o'clock each and every Saturday. So we'll be ready for that. The West Virginia Board of Education is meeting today, hearing the same updates that the Governor releases and hears, and they are right now talking about the first day of school. When we were together yesterday, we were in the first hours of the first day of school, and we are now into our second day, and I must say I am thoroughly impressed with the first day of school. The amount of folks that sent pictures and tags of children being in school, they were so glad to be back with their children. 179 days of work, if I remember from yesterday, to get to that point, to get our children back in school. So for those of you contacting the offices and our hotline, it's 957-1234. It is still open. Any questions you have at all, we have a team there from 8 till 4 p.m. To assist you at any time you need, especially if you have questions about masks or what a color might mean. But right now, 46 out of 55 counties are operating in person, so I could not be more proud of what they're doing. Thank you.
All right, thank you, Superintendent. We'll now go to Scott Adkins, the Director of Workforce, West Virginia.
Good afternoon, and thank you, Jordan and Governor. I want to take this opportunity to provide an update about the lost wages assistance funding provided by FEMA, as Governor Justice alluded to earlier. West Virginia has been approved for $103 million to date. Beginning next week, the week of September 14th, Workforce will start paying an additional $400 per week in LWA unemployment benefits to those who qualify. Currently, West Virginia is approved to pay 5 weeks of benefits, retroactive to the week ending August the 1st, running through the week ending August the 29th. And so that initial payment that goes out will include, if you're eligible for all 5 weeks, you'll get a single check or a single deposit in your account for $2,000 less any taxes that you have chosen to withhold. Individuals returning to work or exhausting their unemployment benefits prior to the week ending August the 1st will not be eligible for LWA. To be eligible for the $400 in LWA, recipients must receive at least $100 in weekly unemployment benefits and must certify they are unemployed or partially unemployed due to disruptions caused by COVID-19. Now, Workforce is handling that through the weekly recertifications for both PUA claimants and also for folks who are receiving standard unemployment. FEMA is providing, as Governor Justice said earlier, $300 to eligible individuals. And under Governor Justice's leadership, West Virginia is providing an extra $100 for a total of $400. As Governor Justice said, West Virginia is only one of 4 states that have chose to pay the extra $100 benefit. Individuals not meeting the $100 FEMA weekly benefit criteria in West Virginia will receive the extra $100 in addition to their regular unemployment benefits. West Virginia is the only state in the union that's providing this benefit, and it will impact nearly 15,000 families for the extra $100. PUA claimants will receive their LWA payments in the same manner as they receive their PUA unemployment payments, whether it's direct deposit or debit card. And those are the independent contractors and the self-employed folks. You're going to receive your LWA payment by either direct deposit or key bank debit card. Other unemployment claimants will receive your LWA payments by check. This will allow us to disperse those LW payments quicker. Once the FEMA money is gone or is fully exhausted, benefits will cease. And I caution folks all the time, so no matter where you are in the stages of your unemployment claim, whether it's being appealed or otherwise, FEMA has directed every state that once that money is exhausted, then those benefits will cease. We understand this benefit's critical to many West Virginians, and as Governor Justice said earlier, we're diligently programming and testing their systems to ensure we pay folks as quickly as possible. Thank you.
All right, thank you, Director. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And since we just had a press briefing yesterday, I will keep my comments very brief. The governor has said what I wanted to communicate to the folks viewing this broadcast and the folks that will view the broadcast. We are in a really very delicate situation and a very important time related to the COVID pandemic. As we have said many times, this is unprecedented. This is a generational event. Old patterns, old learnings don't necessarily apply as well to what's going on now. But West Virginia is being very much negatively affected by COVID-19. We have maintained the worst reproduction score in the country now for 4 days in a row, and we are higher relative to the next worst state than we have been before. We have more cases that are active than ever before. As we look at our cumulative 7-day rolling average, this is not community, this is as congregate and community, we are approaching 5%. We are less with just community spread. And we are in the midst of opening our K through 12 schools in a majority of our counties. And we are working to try to help in all ways mitigate the spread of COVID-19, not only in our Orange and Red County, which is spectacularly important so our children and teachers and athletes and families can get back to going to school and being on the competition field, but also so that we can reduce the spread of COVID-19 and protect people. Because as we know, the long-term side effects of COVID-19 are starting to become much more recognized, and that seems to be irrespective of your age. Some people are affected negatively for a very long time by COVID-19, and we of course want to minimize anybody getting sick. Our deaths have gone up markedly. The time it took to get 100 deaths has been cut in half by the time we went from 100 to 200 deaths. And now we're on our way at 250 deaths to looking at 300 deaths, which is way too many in West Virginia. And as we look to the treatment front, we know that recently a vaccine trial has been stopped, and it's a different type of vaccine using a different virus to be able to give the COVID-19 virus called an adenovirus. And this is the AstraZeneca virus, but they've gone on hold because of a side effect experienced by a person who is vaccinated. So I think as we go forward, we know and we're looking toward vaccines and other therapies to be able to help us get through this time. But West Virginia, by pulling together, we can get through this time ourselves. And it is really, really important that everybody be particularly committed to protecting yourself and protecting each other, because right now we are probably in as much of a challenge from COVID-19 as we have at any other time since this has started. And that's not every county. And we said that with this new coming out, the dancing with the virus, the living with the virus, we were going to treat each county as an independent entity. But it's time for us to come together to make sure that West Virginia is the place that we all want it to be for the people that we care for so dearly. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. By the end of this week, we should have all the equipment in for the additional support to Department of Education for Wi-Fi spots throughout the state, and we'll continue to work with them on some additional unique opportunities to improve that capability as we go forward. Moving forward with additional PPE support to the State Department of Education, Governor's tasked us to focus specifically on providing additional PPE to school nurses to ensure they have the proper equipment to care for our students. Continue a significant amount of testing, as the governor pointed out earlier, and disinfection missions continue at a rapid pace. The quick reaction force construct that we put in place has responded on a couple of the different occasions, to include over the holiday weekend, so that is working well. As the governor pointed out, today marks 180 days of National Guard and our partner agency support to this, and I want to pay particular thanks to our healthcare workers, frontline workers, our partners in DHHR and the other state agencies, and I'm exceptionally proud of the work that the National Guard has done during this 180-day period. Thank you.
All right, thank you, General. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, as you said, and as Dr. Marsh just said, the pandemic continues to get worse each day. We're at this critical moment. Is now the time to consider reimposing restrictions specifically for these, orange and red counties, that when a county slips into one of those, it would trigger, closing of essential businesses, stay-at-home orders, those kind of things that we put in place when the pandemic was far less severe? Thank you.
Charles, a lot of times our people, are saying to every question, that's a good question, but you don't hear that from me, but that is a good question. And the reason it's a good question is because we're looking at that very, very closely. It is a critical time. From the standpoint of a state like Florida or Texas or wherever it may be, this would be a time that they wouldn't even think about. But from the standpoint of West Virginia, it's a time that I absolutely think about. It is a time that we need to react as positively as we possibly can, and do that now before this thing gets into a situation to where it is really bad. So we're looking at every aspect of that, and we're watching these numbers like never before. And so as we go forward, that could very well be a possibility. I hope to goodness, I hope in every single way that we do not have to go to a situation to where we're shutting back down essential businesses and, our hair salons, our bars, whatever it may be, but we're watching it. We're watching it as best we possibly can. And, from the standpoint of whether it was a Texas or New York or Florida or whatever, you've got to remember there's Alabamas and there's Mississippis and there's Tennessees that are closer to like us and everything. And so with all that, we're just, Charles, I could just tell you that in this situation, there cannot be a playbook. We have to be quick on our feet, and we've got to move, and we've got to be fluid, and we've got to change. And that's what we're doing. And that's why, when I tweak something, everybody runs and says, well, he did this, he tweaked this and everything else. But I'm telling you, if you think the people from NASA flew to the moon without tweaking and tweaking and tweaking to absolutely perfect a situation that nobody had ever done before, this is exactly what we're dealing with right here. We're dealing with a situation that nobody's dealt with this before. There is no playbook, and we've got to tweak as we go to make it better and refine and refine and refine. Now, West Virginians should absolutely know they've done great. They've done unbelievable. The numbers tell us exactly that. But we absolutely don't want to slip into being a Florida or an Alabama. We don't want to do that. So we're watching it, Charles. And right now we don't think we have to do it, but but we don't want to take anything off the table.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Hope you're having a good day. Dr. Marsh, can you help put in perspective the transmission rate? It seems like a huge swing when we go from being the best in the country to the absolute worst in the country. And I realize that maybe it could have something to do with the fact that we were slow to start and we're just seeing what other states saw earlier because we had such a low rate in the beginning. I'm just hoping you can help put that number in perspective. Thank you.
Dr. Marsh, before you go, let me just say this, and I don't know that I'm right about this, Amanda, but mathematically I think I am. With us not having the testing volume and everything, that number really and truly, Amanda, you just imagine if we were at 0.85 today, we may very well be in the top 5 in the whole country. And when you change from 0.85 to, I know we're at 1.35 or a number there close to that, but if you change from 0.85 to 0.99, you go flying across a lot of different states. So there's not a real wide, number to play with there. But Dr. Marsh, go ahead.
Yes, thank you, Amanda. So I think that there's really a couple of great influencers, as the governor said. One of the sort of detriments that we have related to how wide the swings can be for us is that we still have relatively fewer cases than many other states do. So when we get a lot of new cases, they are overweighted on the RT Live site, because really what you're looking at is the replication time of the doubling of people that are infected with the virus. So new people get lots more weight than people that have had it over time. And states with much smaller numbers of people that have been infected can swing much faster than states that have a lot of people being infected. So if we went from, say, we had 11 people infected and we get 5 people infected today, then our RT is going to be much higher than if we had 1 million people be infected and we have 5 people infected today. So we have to look at that with a grain of salt. And as the governor said, there is a small difference between many, many states. And I think that the really important thing for us is not only to look at the number and where we are, and that certainly is something that I follow daily and many, many West Virginians do, as well as our whole leadership team. But I think it's looking at the RT value in context with everything else that we've talked about. And what we see is that there is some harmony and alignment related to the RT value that tends to be an early indicator of increased spread, along with the fact we have more active cases than we've ever had. Our daily percent rate is going up. The number of people that have died and the rate in which people are dying has gone up. And as we have seen, like the rest of the country, with the Midwest being so affected, our rural part of our state has become infected with COVID-19. And that's a part of our state where our most vulnerable people live. So I think that this RT value, which is important, West Virginia has wider swings because of our smaller numbers of people that have been infected and the fact we're seeing an increase in the number of people infected today at a rate faster than we've seen in a while, which is making our RT go the other direction. But I think in the reality context of what that means, it's that, we are needing to get this COVID pandemic under better control in a number of our counties, and we see that by the incidence rates as well. And this is really people's lives that we're talking about. And this is also about our ability to take care of our children and our teachers and our citizens. So this is a vital moment for us. But thank you for asking that question.
All right, thank you, Amanda. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question about spread. We've talked about congregate spread. We've talked about community spread, bar spread, dorm spread. What about family spread? If someone tests positive in my family, mom or dad, or maybe the student from school, does the whole family have to self-isolate at that point, and how do they protect themselves from each other?
Paul, I'm going to pass that to our medical team, either Dr. Marsh, Dr. Amjad, or Secretary Krause. But Paul, I'm going to tell you, you're onto something again because Paul, that's a problem. I mean, really and truly, we're highly recommending that if a family member has this, they're going to have to isolate themselves in one part of the house and everything, because that is an absolute problem. But our medical community, and we've been on that, and we've been advising, people as to what to do. But, is Dr. Amjad on today? Okay, she is. Why don't you take that?
Okay, sure, Paul. That's a good question, and actually a very common question. So if you test positive and you're going to have to go home and self-isolate, definitely. And as far as your family is concerned, we'd want them to self-quarantine with you. But if you're positive, Paul, for example, we want you to self-isolate in your home. Pick a room in your house that definitely has a bathroom to itself so that you could use that bathroom. If you're going to be close to any of your family members, we'd ask you to, of course, keep 6 feet away from them, wear a mask, of course, wipe down any surfaces. Try to stick to a part of your house that's not too much of a common area. It doesn't mean you have to be a hermit in your room. You can still use parts of your house that your family is using. As far as your family members being tested, we would recommend if they're symptomatic to be tested, but most likely we'd want your family to quarantine with you during that time period. And then, of course, keep in touch with your local health department. They'd be under their surveillance system, as well as keeping in touch with your family doctor. But if they become symptomatic, most likely they would be tested. But usually the whole family would go under quarantine in their surveillance system with the health department at that time. because we assume that being exposed to you, they'd be under a likely chance that they would be exposed. So the whole family would be under their surveillance system with the health department.
Let me just add, this is Bill Crouch. West Virginians are family oriented. We have a strong predisposition to being with family and being close. And Clay's talked about some numbers in the range of 14%, 17% in terms of spread in families. I also mentioned being in one county in West Virginia and actually looking at whiteboards with names of family members repeated over and over and over, where individuals had become positive and that had spread through the family to multiple family members. So what Dr. Amjad is saying is absolutely crucial to try to keep your family safe and try to keep this disease from spreading to other family members. So please follow those recommendations. We want to try to keep as many people safe as possible, and especially our family, as well as our neighbors and others. So thank you all.
All right, thank you, Paul. Next, we'll go to Lacey Pearson with the Charleston Gazette-Mail.
Hello, everybody. This is Lacey Pearson with the Gazette-Mail. Thanks for taking my question today. This might be more directed to Commissioner Adkins. You mentioned briefly earlier that you'd been testing the computer system to hopefully avoid any backlog issues similar to how we experienced in the spring. So could you elaborate more on that? I mean, do you anticipate any potential backlogs, given that it took us a little while to, sort of configure the money distribution system?
Hey, Lacey, no, to add to what I said earlier about the testing is to make sure that the payments we're able to run the payments through the correct accounts. With the FEMA funding, we can't mix those funds with any of our traditional unemployment funds or with any of the funds from the CARES Act. So the folks who are in the system who have already been deemed eligible for those weeks, as I mentioned earlier, the weeks ending August the 1st through August the 29th, we don't anticipate any issues with that. Now, folks who make application, say today, for example, there could be a little lag in getting them benefits if the FEMA funding is extended beyond August 29th. But as it stands now, if you're already receiving any kind of regular unemployment, whether it's PEUC or PUA or extended benefits or some kind of training unemployment, you're good to go. You don't need to do anything at all. We know who you are. Those claims have already been vetted and approved. And so we really don't anticipate any fraud or much fraud as it relates to the LWA payments from FEMA.
All right, thank you, Lacey. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a question for the governor. And Governor, you're fond of saying that when something comes to you that you don't understand, you say, hey, wait a minute, what are we doing here? So that's kind of where I am on this. So maybe you can help me understand something. And this comes from a multitude of band parents who've contacted me in the counties where bands are still being allowed to play if they're coded the right color. Right now, only parents of band students are allowed to participate in watching their kids perform. And in many families, of course, there are more than one child. And so if you can help me understand the reasoning behind the SSAC rule, let's say there's two girls and they go to school in a county, they're sisters, sleep in the same room, drive in the same car to school every day. One of the sisters picks up the other sister from band practice and takes them home. And yet that sister is not allowed to watch her sibling perform. That seems to make zero sense to me in a stadium where we're already restricting attendance and could probably fit entire families in. So is this something you can look at and maybe revise that, as you did earlier with the SSAC's band ruling, or is it something you agree with? Thank you.
Well, Kenny, your situation that you described, it's hard to disagree with that. I mean, you're talking about two sisters that live together, in the same house, the same bedroom, whatever it may be. That situation is that you described, I would agree with you. The problem is there naturally is other situations that, in regard to families and the number of people in the stadium and all that kind of stuff that are stuff that I'm sure the SSAC is taking into consideration. Now, will I look into it more? Absolutely. Will I look at the possibility of tweaking it and everything to be able to help families be able to enjoy their kids? Absolutely. Can I promise that that'll be done? I can only say that what will be done will be the safe thing, the safest thing we can do. Because right now, there's going to be, we hope and pray, a lot of games and a lot of opportunities for our bands to play. But we surely know that right now we've got to make the right decisions, and West Virginians have got to show their mettle right now. They have to. They've already done it to the world, but right now we have got to show our mettle. Now, with all that being said, I'll look into it. I hear you. The situation you described, I could not possibly do anything but agree with you, and we'll look into it, and we'll try to do something about it if we need, and if we can, tweak it and make it better, we'll tweak it and make it better. There may be those that criticize, because they may say, well, at first we weren't going to let the bands in, we let the bands. Well, for crying out loud, we did the right thing. We just did the right things. And as we tweak, we're not going to make every right decision. But as we tweak, we're tweaking to make it better. That's all there is to it. Like I said, don't think for a second that those people that flew that rocket with our astronauts and landed on the moon didn't tweak 10 million times to make it perfect and make it happen. That's how you make it better. You make it better by doing the very best you can and then tweaking it as you go and everything. So that's what we're going to continue to do.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. I don't know that my question's too terribly different than a few questions from before, but I guess I'll phrase it this way. What is the line in the sand for when actions will be taken, whether it be statewide or whether it be, on a county by county basis? Obviously, there are many counties that are seeing issues, and there are some counties that, have fluctuated by, a handful of cases up and down, but haven't had a predominantly bad outbreak. But what is the line? I know at one point we talked about, I think 3% on the cumulative percent of positive as being the line. If we're starting to go above that, then there's a problem. Of course, we're sitting at 2.55. Not super bad, but it has been trending towards that 3% now for the last 30 days. Is that the line that we're still kind of putting in the sand for doing restrictions? I know we're at 25 people for group gatherings and whatnot. I just didn't know if that criteria had changed or if that's still kind of remaining what we're doing as the line in the sand for when we need to take further action, whether that be on the shutting down certain businesses, whether it's telling everyone to stay home again, what have you. Thank you.
Okay, Stephen. First and foremost, if you're in this job, it's all going to come to rest with me. And I get that. And I'm honored by that. And I'm going to do the right things with that. To answer your question, first and foremost, we're going to listen to all the experts. And we're going to first and foremost listen to our medical experts, because we're not talking about just nothing here. We're talking about people dying. And so we're going to listen first and foremost to our medical experts. But you asked the question about what's the line in the sand? Well, the line in the sand, now that we have that cumulative positive number of less than 3%, and we're at 2.55, Stephen, for us to get all the way to 3% now, because we have now built in so many good numbers that it would take a long time for us to get to 3%. So if we just clung to that and we just said we're not going to change until we get to 3%, bad move, bad move. So we're watching that, no question. But as we go forward and everything, we've got to absolutely be able to be light on our feet and move in a matter of hours and not weeks or months, because it will take weeks and months of bad numbers to move that to above 3. You know, you've seen the numbers that have come in the last little bit, and we moved from 2.53 to 2.55. It'll take a long time, a long, long time for us to get there, unless the numbers get catastrophically bad. But we need to be ready to move, and that's why we're going to get more and more information, more and more looks at the numbers, more and more input from the medical team. And then if we have to move in the next days, we'll move. We'll move. But right now, we don't have to do that, and I hope and pray we're not going to have to do that.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. Governor and Superintendent Birch, I'm wondering if you have received the letter from the Senate Democrats criticizing the school reentry plan. They claim they've talked to numerous teachers and school service personnel and say there's confusion over personal leave time if somebody has to be quarantined, and there's inconsistencies in PPE distribution and training. So I'm just wondering, and they're also saying some teachers are being threatened with their jobs if they complain. So I'm wondering if you've read the Democrats' letter and what your reaction is to it.
Clayton, before you go and everything, let me just say this. Mark, does that not first and foremost have a political flavor to it? And we've tried to stay away from the political flavors. You know, I absolutely think that, you know, Superintendent Birch and his team have done magnificent work. It's not going to be perfect. It's not going to be perfect, but it's sure not going to be political, and it's going to be done the right way. But anyway, sure.
Absolutely. So, Mark, yes, we received it, and I actually was able to speak to the 3 senators as well as several others as they prepared for openings. I have absolutely no problem with my door being open as it always has been. With the questions and concerns they have, I'm actually reaching out to their superintendents to make sure that communication is clear. And I rely on those superintendents to continue working with their local delegates and senators too. And we want to make sure that communication stream is well oiled and working well. So as we broke down the letter, the largest concerns seem to be around communications. We actually have FAQs, frequently asked questions, on our website. If any teacher has a question about leave and their rights, we've worked with all of the unions and superintendents and teachers. And then we worked our way down through some of the issues around preparation, personal PPE. I'm not sure, maybe it was written after the announcement the governor made on additional $50 million invested in PPE. So, but we will continue to monitor, and we're going to be asking each and every principal over the next several weeks to also monitor how things are going. We expect a report by the end of the month that we can use to assist the governor and General Hoyer and DHHR as we move forward.
And I want to say one more thing too, in regard to the $50 million that we were able to bucket from the standpoint of the CARES money for, you know, for additional security and everything from the standpoint of PPE or testing. First of all the information that I have that has been given to me through the Department of Ed and through the accumulation of all the county superintendents and everything is, you know, we were great to start, you know, and we look like we're in solid ground. We had $91 million of dollars to work with in regard to all the different programs and everything. So at the end of the day, you know, that money, to the very best of all of our abilities that we have, we don't really think we'll need that money, but we don't really know for sure, do we? We didn't need it to start, but we don't really know for sure. And so what do? We got the monies available. Let's bucket it over here just as an insurance policy to make absolutely sure. to give everybody the peace of mind that we've got all the dollars we need and we can move very quickly with that. Plus, from the standpoint of all that the National Guard has told you, 2 million masks in stock and on and on and on. So that's what we've done.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. There was mention earlier, and there has been mention at earlier press conferences about a desire for more testing, particularly among young people and athletes, because they may produce negative results that would then affect the map. But I wonder if that's the case, if the map is actually based on daily positives averaged over 7 days. Is that assumption true, that negatives would affect that some way? Secondly, on the map, I'm wondering what's going on with Pocahontas County. Is its turn toward orange a fluke or a trend? Thank you.
Okay, I'm gonna have to let Clayton, or someone, answer the question on Pocahontas County. From the standpoint, I want to make sure that everybody really totally understands what I'm saying about testing athletes, testing students. If we would have tested, and I keep going back to the same thing, if we would have naturally, let's just be smart. If we would have tested 3,000 kids, staff, athletes in Kanawha County when we had a breather of a week right there, what would have happened? I mean, no matter what we would have tried to pull off, what would have happened? What would have happened was this: we would have had an enormous amount of negative tests that would have impacted the color code. It would have. It just would have. If we would have done it, it would have impacted the color code. Now, whether that's good or bad, is surely argumentative, and it doesn't really matter to me. It's just fact. That's just fact, and it doesn't matter. What really does matter is just this: by doing that testing, we would have obtained an incredible amount of knowledge and information that we're not testing that demographic as on a wide scale basis. And not only that, we could have pruned out a few that happened to be positive that would have really benefited us from getting this county, from an orange level maybe down, instead of maybe continuing to spread and been able to really help us there. But from the standpoint of just testing so we can come up with a bunch of negative results, that's preposterous. That's silly. That's absolutely silly. We don't need to do that. All I'm trying to explain to you is if we would have done this, how the math would have worked. We would have had a ton of negative tests. It would have impacted the colors in Kanawha County and probably the other counties that we were going to test to some degree. But the number one thing it would have done, it was have brought us an incredible amount of knowledge about that demographic that we don't have that much knowledge about today because we don't test that demographic. Because we are only testing, for the most part, people that have some level of symptoms or concern or whatever it may be. Now, from the standpoint of the next part of the question, Clayton, you've got to answer that.
The Pocahontas question might want to go to, I don't know.
To Bill Crouch, maybe?
To Bill or Clay.
Okay,
I think
well,
that's going to be more about the shift quickly to orange.
Okay. Now, and what I've been told, was just this. Based on the numbers and the information that we have today, Pocahontas County is orange. But, Bill, maybe you can add something to that and everything, because I've been told that we're still reviewing numbers.
Yes, Governor, we can add to that. Dr. Amjad's actually looked
Sure.
into that and can give you a little more information on it.
Sure, Brett. It is orange, and we are reviewing the data, but Pocahontas County has about 8,000 residents, and yesterday 10 people were entered into the surveillance system. It is a case where we need to look at the data, but because it's such a small county, they had 10 new cases entered yesterday, which did flip it from yellow to orange, but we are going to look into it more because it did cause some concern for that county. But it is correct. It is orange right now, but we are going to review some information for that county over the next day or so.
All right, thank you, Brad. Next, we'll go to David Beard with the Dominion Post.
Hi, I have another kind of a WVU-related Red County question. Dr. Marsh often talks about the sledgehammer and the scalpel, and I think some people feel that maybe the bar closure for the whole county is a bit sledgehammer-like, and there are so many of them that simply don't cater to students. Jeans down in Greenmont or bars out in Western Mont or on the way up to Preston County. And we also have to keep in mind that the border is somewhat artificial because Morgantown's closer to Pennsylvania or Brewston Mills or Masontown than it is to Blacksville. So I guess some people wonder, is there a way to take a more scalpel-like approach to containing what's going on at WVU so that businesses that have nothing to do with students aren't really suffering because of them? Thanks.
David, there's always different ways and everything, but the reality is just this. We tried to really bear down and work with the bars and everything, with the students and all that kind of stuff. And the very first thing we got was a flood of pictures with a flood of people standing, on top of one another with no mask on or anything else. What are you going to do? What are you going to do? I mean, you can't just say, well, we'll just live with it. I mean, we've got a county that's red, we'll just live with it. Well, you can't do that. And the other thing is, from the standpoint of any bars that are serving food, they're good to go. They're good to go, and they're not affected in this in any way. So it is a situation, and I hear you, from the standpoint you're really close to Pennsylvania, kids can move around and do all this stuff and everything. I get it. I get every bit of it. But in this situation, with where we were and what we saw, you got to react. You got to do something. You got to do something. I mean, the great people of Mon County deserve and need me to react. And in that situation, we can't have that situation, or this situation is only going to get worse for everybody. And as it gets worse for everybody, we're going to be reading somebody and say, an 83-year-old from Mon County, a 42-year-old from Mon County, and we don't want to be doing that. So we had to react.
All right, thank you, David. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, everyone. My question is on people who have recovered from the coronavirus. As state and local health officials are responding to outbreaks in congregate settings like correctional centers or nursing homes or healthcare centers, how much are we monitoring people who have recovered after the outbreak? And what are we doing to inform people who, we have recovered of some of the longstanding health risks that they still face even after they've recovered and they're no longer kind of immediately sick?
Okay, Dr. Marsh, Dr. Amjad, Secretary Crouch, just as you guys.
Okay.
Bill or Ein, do you want to take this one?
Sure, I can answer some of them, and then you can go. Emily, a lot of it is still ongoing, and a lot of interest is in that. But most people need to follow up with their healthcare providers for those questions. We do encourage, of course, we know with the MISC case of the child that was here in West Virginia, that it's very important for children who have COVID-19 to follow up with their healthcare providers, because MISC is seen about 4 weeks after the case. So we know children who have COVID-19, we do want them to follow up with their healthcare providers. As far as adults go, we do think it's important as well. We do see a lot of after effects. We've seen things with the heart, definitely, and even some vascular issues. So we want adults as well to follow up with their healthcare providers. So as far as any long-term studies go, I'm not clearly aware. Clay might have some because he's up at WVU, so I'll let him speak to that. But there's definitely some long-term effects with COVID-19. There's a lot of interest in it. So I'll let Clay speak to any more in-depth knowledge up in Morgantown.
Well, thank you, Ein, and thank you, Emily. One of the issues, as you allude to in your question, and that Ein really spoke to, is the concern of longer-term impact. on people who have recovered from COVID-19. And I think it really does bring to light the need, and it's a good reminder that having a focused effort to make sure that we're tracking people longer term so that we understand more, not only about COVID-19 in general, but about how our people, our citizens may have problems longer term related to this generational infection. And that's something that we are planning to do in some areas in Morgantown. But I think that you've sort of brought to light the potential that we might really be best served in making this a state effort. So thank you for your question, and you've stimulated some additional thought and maybe some additional action. So I appreciate that.
All right, thank you, Emily. Our last question today comes from Christina Cass with WVVA.
Hi, yes, this is Christina Cass with WVVA. So this may have already been addressed a little bit earlier, but what are the updates on workforce operations concerning unemployment? We've had a lot of viewers calling in daily to say that there's a 14-day wait limit to file for unemployment, or that, and this has been more of a prevalent issue, that they can't even get through to file. What is being done to kind of combat these delays, considering the concerns for this, is that they really don't have the time or the means to wait for this filing, especially with it being detrimental to their current living situations. Thank you.
Scott, this is you, and Scott, you know this, and General Hoyer, I think, still on and everything, but Scott, any resources that you additionally need to be able to help in every way, I'm telling you from the standpoint of the Guard, I'm all in. I know the Guard's all in, so anything we can do to make things a little faster, a little better, we sure want to do it. But Scott, if you can answer this question, you're going to have to answer this one.
Yeah, absolutely. And thanks to Governor Justice, your leadership and really understanding what it takes to get unemployment to folks who need it is greatly appreciated. And again, I want to go back to what Governor Justice said. That's a great question. And I can tell you that if you're filing for regular unemployment in West Virginia, that's pretty straightforward. There could be a delay in getting information back from the employer that the claimant previously worked for. And so there's some due process issues there. If you're a PUA applicant, and those are those independent contractors, self-employed folks, I can tell you, Emily, we've received in the neighborhood of about 80,000 fraudulent claims so far for folks who are trying to apply for PUA benefits and they're not eligible for. That does slow the process down. There's no way around it. We have to vet those claims individually. We have to ask for specific identification information. We have to ask for specific income information to justify that claim. And so there is a little delay there in the PUA claims. But if you're filing for PEUC, extended benefits, regular UI, there shouldn't be a delay at all. And keep in mind that application, folks do the application themselves online. And so provided everything lines up as it should and there's no issues with separation, then that claim is processed timely. But again, if there's separation issues, or if the employer says, hey, wait a minute, he or she didn't work for me, or they quit, or they decided not to return to work when work was available to them, there is going to be a slight delay in that, again, because of due process. And the federal government requires us to do due diligence in all those questionable claims. So even though I apologize for the delay, it's unfortunate. And it's also unfortunate that there's so much fraud that we have to look at to get to those legitimate claims. But rest assured, folks that work for us, all of our external partners, assistants with the Guard, with folks in our external call center, are working extremely hard to make sure that folks who are eligible for those benefits get them in a timely manner.
All right, that's all our questions today. Governor, I'll turn it back to you.
Okay, well, I really don't have anything as far as the notes on our different speakers and what they've said and everything. I just want to clean up one thing, and that's just this. West Virginia, I need you right now, and you need yourselves right now. Without any question, we have been the envy of the country and the envy of the world in many ways. Without any question, we're at a crossroad right now that we all know. We all, especially from my end and all the medical experts, education experts, all the guard, all of us know how susceptible and vulnerable we are as a state. Now, we need you in every way. We need you to step up without question and show that medal that has absolutely earned you this great, incredible badge that West Virginia carries with us as being this miracle so far. Now let's just step back. David asked a wonderful question in regard to the scalpel or the hammer, in regard to the bars and the situation in Mon County. I said, you've got to do something. You cannot try to move forward and have the pictures and all that happened and sit idly by and not react. And so we reacted. And we said, we can't do that. We've got to close the bars. From the standpoint of just this, when I said, you've got to remember, we're talking about serious stuff, life and death, people dying. But it's serious in lots of ways. It's serious from the standpoint of Monongalia County is not in school. And you've got families that need to go to work and they can't go to work because of the daycare and all the issues, the economic issues that go with it. And everyone should know, I want our kids in school so badly. It's unbelievable how much I want our kids in school, only if they're safe. Only if the teachers are safe there. Only if the service personnel are safe there. But with all that being said, I just plead with you, West Virginia, help me. Help me as you did with the census. Absolutely have street leaders and community leaders and leaders that will step up and try to help one another. Absolutely, West Virginia, I know you can do it. You are the greatest of the greatest of the greatest. You're the very reason that I decided to run for governor. The very reason, because I love each and every one of you, and I believe in you, and I believe in this state beyond good sense. And I mean it. And it doesn't really matter to me who believes and who doesn't believe. I know it in my heart, and that's how I feel. But right now, I need you. I need you really badly right now, West Virginia, because this thing is turning, and it's turning in a way that we do not want it to turn. Absolutely, right now, West Virginia, make a difference. Make a difference for all aspects of this. Going back to school, the nursing homes, the next fatality, even all the way down to the situation that, I was contacted yesterday from a great coach again at South Charleston. And I don't get into names, but a great coach. And he's telling me that he's about to lose his kids from the standpoint of his football team because they don't know what to do. And some of them are being told they need to go get a job by their moms because their moms need to stay home. This situation is filtering all through us and hurting all the way through us. Now, we can't go back and we can't do something that would be silly and only compound it and make it worse, where more would die and more problems we would have. But we can stop it because we have the means to be able to stop it and stop this pain all the way through. Coach, I hear you. I absolutely hear you at the nursing homes. I hear you all across West Virginia. Try to help us. Let's make this better, and let's all run across the finish line together. God bless each and every one of you. You're the best of the best. Show it. Continue to show it. Help me. Thanks a bunch.